All right, so thank you everyone for joining us this morning for the Keeping Employees Safe and Job Sites COVID-19 Compliant webinar. This was prepared by us, BIA of Clark County, and if you're unfamiliar with us, our basically core mission is to protect and promote the building industry. We have about 700 members and we represent around 12,000 employees within the building industry. This was created with L&I, so it is L&I approved. It has gone through their series of review, and so it's gone through with a fine-tooth comb. Thank you so much for joining us, because honestly, in order to keep job sites open, to stay in phase 2, and to reduce the spread of COVID, it's super important to remain compliant and also to protect your business, because you don't want to be one of those companies in the news that gets fines or faces stricter penalties. So with that, we will get started. Just for a little bit of background, my name's Andrea Smith. I'm the Communications and Education Program Manager here at BIA of Clark County. I am also the coordinator for the L&I contract that we have, which is basically just doing outreach to small businesses within the construction community to bring this COVID information to them. Also on the call, we have Avery Scarpelli, which is our executive director, and I believe, yes, Ryan McKinster, our government affairs director, is here as well, and he will be helping to answer any questions that might not be covered under my training with COVID compliance. So just to talk a little bit about what coronavirus is, if you didn't know and you've been living under a rock for the past year, this is a requirement to address. It's basically a type of virus that is similar to the common cold, but can cause much more serious health effects. And of course, it's contagious and it spreads from person to person. So the symptoms are obviously mild respiratory illness, fever, cough, shortness of breath, chills, muscle aches. Everyone pretty much is aware of these things, and that symptoms typically begin around 2 to 14 days after exposure. And we've heard a lot about the dangers of those that are asymptomatic and spreading the virus even though they may not have symptoms. Again, it is spread from person to person through respiratory droplets and aerosols. And that includes coughing, sneezing, singing, and even talking. Also can be spread through contaminated surfaces or objects. And again, it's important to stress the asymptomatic. So what to do if you feel sick, or if a worker comes to you if they're feeling sick. So you should stay home and contact your healthcare provider. And now that testing is more widely available, obviously getting a test. If you have been infected, you may have not had symptoms for several days, and so you could have passed that on to coworkers, other family members, etc. And if you're not the employer, be sure to inform your supervisor so they can determine who else may have been in contact with you, and they can take the proper precautions, which we'll talk about later, to address any outbreaks or widespread infections. So who is at risk? High risk is obviously the constant exposure to the virus. So that would be construction projects within a healthcare facility, long-term care facilities, and nursing homes. That is an authorized risk category, which we'll get into a little bit later. The extreme risk category, which is not authorized for construction, is something that you will want to take into consideration. So if you are, working on, well, you wouldn't be because it's not allowed, but working within a hospital where there's a huge infection rate of COVID patients, that would be considered extremely high risk and is not able to happen at this time. But if there's, proper precautions taken into consideration and you're just working on the healthcare facility or whatnot, that is okay, but it does require higher level of PPE, which we'll talk about later. Medium risk is any job that requires you to work several times a day within 6 feet of others, and possibly within a room between 3 to 6 other people. So generally, that's when people are fairly healthy and you probably won't get the virus, and you're exercising the proper precautions, like the proper face coverings, to be able to mitigate any high risk. Low risk is also where you can stay 6 feet away from coworkers and you only briefly pass by them a few days. Again, this does require PPE during those times, and social distancing. Again, we'll talk about those specific face coverings later. And then negligible or very low risk is when you're working alone. So that and low risk is typically what a lot of our construction projects and job sites fall under. And so that is the only instance in which someone would not need to wear a face covering. But it's important to remember that you keep a face mask with you at all times, just in case somebody, walks on the job site unexpectedly or whatnot. So protection measures, obviously the social distancing of 6 feet or more, frequent hand washing, and hand sanitizer if soap and water is not available. You need to sanitize and clean and disinfect work surfaces and shared tools, and cover your cough, sneezes, and wear a face covering. Also, don't touch your eyes, nose, or mouth or anything with unwashed hands. And of course, staying home if you're sick is the #1 important way to stop the spread of COVID. So face coverings and masks, and of course respirators, they all help to reduce the spread of the virus to others. And so there's some other information here from the CDC and whatnot, and there's a link included, which I will send out this presentation later after this webinar wraps up, and you'll be able to click on that, which takes you to the official LNI which mask for which task PDF, which gives you all of the risk categories that we were just talking about, and the appropriate masks for those, as well as basically the acceptable forms, whether or not you can make them at home or buy them at the store or whatever, and all the things that go into that. So again, face coverings, masks, respirators, they all fall under which mask for which task. So like homemade cloth face coverings are more for low risk jobs. You can also purchase them. Those are where you don't really come into contact, or it's very limited contact with people on the job site. And then disposable surgical style or dust type masks are for the medium risk jobs, just because they keep in a little more of the droplets, and you lower the risk of transmitting the virus. And then for those extreme risk and high risk categories, that's again working in facilities that maybe have the virus present but not necessarily known, and also those instances where job sites, maybe you're in a trench or something and you're super close in proximity to others, you do need a respirator for that. And if the respirator doesn't cover the eyes, you will need to wear some sort of eye protection as well. So as for COVID-19 specific requirements for construction, this is outlined in the phase 2 reopening requirements from, what is it, like, I guess a little over a year or almost a year ago, and has been, adopted by LNI, and they are in, they basically have to, make sure that every company is complying. So if they show up to your job site unannounced, you want to make sure that you have all these things in place so that you can show that you are attempting and are doing your best to stay compliant. And so with that, one of those things that you need on your job site is a job site hazard analysis. So you have to perform that before the work starts on each job site. So if you are a home builder and you have, let's say, 3 different subdivisions that you're working in, you need to do one of these for each of those. And with that, you also need to do an exposure control, mitigation, and recovery plan so that anything that you've uncovered in the job site hazard analysis can be mitigated, and you have a plan for if an outbreak does occur, and how to minimize exposure for workers or potential homeowners or realtors or anybody that could be doing a walkthrough or an inspection and whatnot. And then you should also designate a COVID-19 supervisor for every job site. So this only does not apply if it's a residential family site with 6 or fewer workers, but I would definitely suggest that even if you fall under that category, you still basically have a COVID-19 supervisor, because I mean, it just shows that you're going through the extra precautions. And if L&I shows up and you possibly are not adhering to any of these requirements, that might help to minimize the penalties that you face, because you are going above and beyond. You should also do weekly toolbox talks or safety meetings to reiterate what the protective measures are in place for reducing the spread of COVID. You also should be doing, like before the job site actually opens up. So say you're going and you're starting a new development and you guys are just starting work. So before the works begins, you should be hosting a preliminary safety meeting to go over all of the things that you've uncovered in the job site hazard analysis and exposure control, mitigation, and recovery plan. And basically just talk about the protective measures that you're taking, and then follow up with those reminders every week. And then again, if you're performing a task with less than 6 feet of distance, you are required to wear higher level of PPE. And again, it requires on the task and the risk level. So that's going into what we talked about earlier, where if it's medium risk, it's more of the disposable or dust mask type and surgical mask type of mask. And if it's higher risk, the respirators. So as we stated before, if you're working alone, you're not required to wear a mask unless you're exposed to other hazards. So that could be silica dust, chlorine gas, etc., anything that can cause other health issues. Obviously, that would be a no-brainer. You should be doing those things, but it's always great to remind you guys. So if in doubt, it's always better to wear a mask. If you're not sure what risk level you're at, it's best just to take the proper precautions. And then you also want to have a hand washing station. It has to have running water and soap. And if that is not available at all, sanitizing stations are okay. But if you do have access to the running water, you should be using it. And it's important to make sure that it's draining properly so that like it doesn't become, a water issue. Or I know Ryan can talk to this later because we've had some inquiries about that. But and just basically a water draining issue. Aside from that, you should be keeping a frequent cleaning and sanitizing basically schedule. So you'll want to make sure that many times throughout the day and many times throughout the week that you're allowing people to go wash their hands or sanitizing tools or machinery that you may be sharing. And then same goes for like if you're showing a house, you will want to make sure that you're wiping down any of the doorknobs, anything that's been touched, light switches, etc. So temperature and symptom screening can be done at home, and then they can report to you verbally, but you cannot take like a roster. You can't say like, oh, Jane Doe said she had a temperature of 100 degrees or whatever, or so-and-so had a temperature of 98.6. Like, you shouldn't be taking that information. You should just be hearing verbally that they took their temperature and that they don't have any high temperature or alarming temperature readings. Workers are also required to stay at home, and you should also mandate that they be sent home if they feel or appear sick. And to go back to the sanitizing and disinfecting, if somebody does appear or feel sick and you need to send them home, you should always stop what you're doing and sanitize the entire job site as much as possible, and require people to wash their hands, because you want to take every step you possibly can to reduce the spread of the virus. And then again, eye protection is required for tasks that can't maintain 6 feet of social distancing. That could be goggles and other things that could protect your eyes. Again, it's super important, and L&I really wants us to stress that people understand which mask is required for which task. And again, that's going back to those high, medium, and low risk categories and the appropriate masks that go along with those. Again, working alone during breaks and other things, social distancing should always be maintained, but you can lower a mask for breathing, for adequate breathing, because I mean, mask fatigue is real, and you know, sometimes it's nice to just be able to breathe fresh air, not through a mask. Face shields, a lot of people ask about this. They are not suitable alone, but you can use a face shield and also another form of a face covering to make sure that you're not just protecting yourself, but also others if you are infected with the virus. And then same thing goes for bandanas. A lot of people think that bandanas and scarves and such are an appropriate form of a mask, but that is not the case, because like face shields, they can still allow some of those droplets to get out and infect others. And then again, for respirator use, you'll want to make sure that you do the initial and annual fit testing. There's a lot of information about that through L&I and DOSH, so you'll want to take a look at that. I am in no way an expert on respirators, so I don't really want to give you much more than that. And then also, we've had a lot of questions about workers traveling together in a vehicle, so they should maintain 6 feet of social distance. And you know, you shouldn't be spending more than an hour in the car with them to be considered anything less than medium or low risk. So if you're spending more than an hour and there's more than, or yeah, if there's less than 6 feet of social distance, you would have to wear a more appropriate face covering, which would be a respirator, which seems a little ridiculous, but that would be a high risk category. So it's really important that you take the proper precautions, wear the proper face coverings, and you know, just make sure that people are being protected, even if you need to carpool. And you should always, always, always try to allow workers to drive themselves to a job site. I know that's not practical on some points, but again, if it's not practical, make sure that you're wearing the proper face covering and eyewear. So if someone works for you or your company and has symptoms, tests positive, or has been exposed, you should immediately cease work. I had mentioned that earlier, and you should send the worker home. Definitely make sure that they're seeking medical advice and or COVID test. Medical advice, that would mean that they would need to speak to their doctor, obviously, but they would then quarantine. But if you wanted to not necessarily quarantine, you could have them take a COVID test, and if it comes back negative, they could come back to work after they get that negative result. And then, of course, after you stop the work, make sure that everyone is hand washing and disinfecting everything so that, you know, any germs are killed and you can go along with your work day as planned. And a more stringent approach, of course, would be to test all of the workers. So if you are concerned that there would be an outbreak and it wasn't just one person, you could stop work and make sure that everybody goes and gets a test and everyone comes back as negative. Or if they do come back as positive, they follow the proper protocols for getting healthy again. That is a more stringent approach. It's not required at all, but I mean, if you as a company or your employer wants to take that on to do their best to, know that their employees are healthy and do not have the virus, like, go ahead and do that. Again, you must notify Clark County Public Health within 24 hours if you suspect that COVID is spreading in the workplace. So that's anytime 2 or more employees have a confirmed or suspected COVID case within a 14-day period. And then they can also help you as well with any of the recovery plans and like getting back to work. And it's important just for their contact tracing as well, because they're going to want to contact everybody that has come in contact with that person who may have tested positive, aside from just their coworkers. Because I mean, every day we go to different places, like the grocery store. Now kids are going back to school, so it's important that we take all the proper precautions that we can to minimize community spread as well. And then you can also alert your other workers if you believe that they may have been exposed to COVID, but it is important to respect the privacy of the person who may have tested positive, and also to basically adhere to the provisions of the ADA. So you do not want to say who that worker was. You just want to say, hey, somebody may have tested positive, just letting you know you may have been exposed. Go from there, kind of thing, but never say their name, and try not to give any details that could possibly identify that person. And then all of these things, if they're not taken into consideration and you're not practicing them regularly, you could definitely face fines upwards of $10,000. And there's been local companies, not anyone in the industry, thank God, that has faced some of these. I think the last one I saw on the news was like $4,500, and I think it was like a car wash or something, was the fine that they got for not mandating the mask wearing in their place of business. So it's really, really important that you definitely keep all of these COVID precautions and job site requirements top of mind. And, if you're on a job site and you see somebody else not wearing a mask, or you see that they're not disinfecting their tools or their shared machinery, any of those things, if you see any of these things on the job site, definitely remind people. Like, you want to be a good steward of the industry, and to remind people that not complying doesn't just mean fines, it also means that we could potentially face an industry-wide shutdown if a huge outbreak were to occur. So it's super, super, super important. And peer pressure does work. People definitely, if they're called out, they're gonna wanna not feel like, they're not respecting your health and safety or another. So reminders are always great. We're always here to help you. So whether it's me having gone through the COVID training, Ryan, who is our government affairs director, who can answer any other questions, or any of the other staff here, we're always here to help answer any questions and get you into contact, even if we're not the right person, with somebody who does have the expertise and the knowledge to be able to help you. So our office phone number is listed here. Wanted to alert you that BIW has a few COVID-specific webinars, and as well as NAHB and a few others, and we've basically put all of those on our COVID website, which the link is embedded in here, and you'll get that later, but it's BIW or BIA.org/COVID. And then If you want to talk to a labor and industries representative directly, you can. Their phone number is listed here. And they actually do free consultations. And I have been told that they won't check up on your job site for up to a year if you take that consultation. And you know, they go through with a fine-tooth comb and make sure that you're doing everything that you need to stay compliant as well. So I definitely would recommend doing that. I know sometimes within the industry, we're kind of like, oh my gosh, it's L&I, like we don't necessarily trust them, but the fact that they come through, help you with a safety plan and to comply and not come back for a year for an inspection, pretty good benefit there, I think. The next steps, again, if you see someone on a job site, remind them to wear a mask and follow all the health and safety requirements. We will be rolling out some Spanish and Russian videos and social media content to help spread this message out to others that may be non-English speaking, and in the building industry, and those who are not members. So that's super important, because we're trying to do the best that we can to make sure that people within the industry, even if they're not members, are following all of the precautions and are staying compliant. And then we will alert all of you when we gain approval from L&I for our COVID-19 site supervisor certification course. So this would be like if you have employees that you want to be certified to basically be the site supervisor, and it just gives them an extra layer of like, I guess, credibility when they're being certified by the BIA and L&I. Like they know exactly what they're doing, and they're, you know, it definitely gives them an extra layer of authority. We do have some additional resources here for you. These are all found on our website. That's the BIA of clarkcounty.org/COVID, and embedded in here, which I'll send out, includes toolbox talks, different scenarios and benefits for paid sick leave in case somebody were to get sick and they need to take time off, different job site safety fact sheets, all kinds of different resources that you could possibly need, printouts for job site posters, notices, etc. I've put in a training video. I will not play it because I'm sure a lot of people know how to put it on and off correctly. But this is just for like if you are onboarding an employee, or maybe you don't know how to use it, you can definitely access this later when I send this out. It is important though to reiterate, and you could possibly use this as a toolbox talk or safety meeting, one of your weekly requirements, to just remind people the proper way to take it on and off. And NHB created English and Spanish. Spanish is on the next page here. They created toolbox talks specifically for construction. So it basically goes through everything I just talked about, and L&I has gone through these videos to make sure that they are compliant with Washington standards, and they are. So you can definitely use this for your weekly safety meetings, to reiterate what we're doing to protect those in the industry. And I think that is it. If anybody has any questions, you can type them in the chat box or unmute yourself and ask. I am available for questions, as is Ryan, who's on this call. So if I don't know something, potentially he will. And if we don't know it and you ask a question, we'll definitely connect to the right person and follow up with you after this. But we'll remain on here for the next 5 to 10-ish minutes, depending on if we're getting any questions. And I don't know, Ryan or Avery, if anybody has anything that they want to add.
I do not. Questions?
Oh, thanks, Ken. Thanks for coming on. Yeah, thank you everyone for coming on today. It's super, super important that we are maintaining compliance and are going above and beyond to show people that, we do care about their health and safety, and we want to work, but, there's a time and place, and we need to make sure that people are not getting coronavirus. So, yeah. I guess if we're not getting any questions, I'll go ahead and end the webinar for today. I will be sending this out as well as actually, I'm going to drop it in the little thing here. We have a COVID job site safety plan that's L&I approved here, that I'll drop in the chat here that you guys can take, but I'll also send that out as well to everyone who is on this morning. And I will also send out a requirement for job site handout, which is everything that I just covered, but basically in a few different pages, as well as which mask for which task, so you don't have to go looking for those. They're uploading now. I'll stay on for about probably 5 more minutes, but you all are free to log off if you would like. Thank you so much for your time, and we will follow up with all of you with these pieces of information right after the meeting. Thank you so much.